It is now live on Facebook.
Okay, it's live on Facebook. We'll give it just another 60 seconds just to get the links all out to everybody, and then we'll start. Thank you for your patience. We will start shortly. For those of you who have received the Facebook link, if you could please share them, and then we will start very shortly. Apologies for the delay. Okay, the links have gone out. Okay. Okay. We'll start now. Bismillah. Alhamdulillahi Rabbil Alameen. Wassalatu wassalam ala Rasulillah sallallahu alayhi wa sallam. Amma ba'd. Assalamu alaikum wa rahmatullahi wa barakatuh to everyone who is joining in. Thank you for joining in with a live stream. Please share the link. There will be a YouTube link also sent out possibly after the event. Firstly, thank you for everyone for organizing the event. All the background work took a long time. And to our doctors who joined us and taken time out of their schedule. The aim of this Zoom session today is to dispel a lot of the myths around the COVID-19 vaccine. We've seen a lot of horror stories, a lot of misinformation being shared around, and we felt that it was very important to clarify this, especially within the Asian community. There's been a lot of forwarded WhatsApp messages which have not been verified by specialists, and it's caused a lot of anxiety within our community and the extended community as well. Just as a quick disclaimer at the beginning, Islam Bedford are not saying yes to take the vaccine, nor are we saying no to not take the vaccine. It's just purely to get the information out with our doctors who we are joined by. Before I introduce the doctors, we did a quick poll on Islam Bedford's extended social media. Hopefully on the screen now will come up some of the questions that were asked. We had around 60 to 90 people that had taken part in the poll. Just a couple of questions, if you just bear with us for 15 seconds. Yeah, okay. So the first question was, do you feel you have enough information about the COVID vaccine? So 50 combined result from Facebook and Instagram, it was 54% said yes and no was a 46%. Next one was, will you take the COVID-19 vaccine if offered in the next 45 days? So 51% said yes, 60 days, 49% of people agree to that. Final question, I believe it was, will you and your family take the COVID-19 vaccine if offered? Yes, 50%, no, 43%. I'll do one more question. Yeah. Do you know anyone who has been hospitalized due to COVID-19? 72% said yes and no was 18%. So interesting stat. We will put out another poll after this, maybe in a couple of days, to see how people's reactions have changed. The three doctors that are joining us are Dr. Muhammad Azher, who's a respiratory consultant and general physician, Dr. Mansoor Raza, consultant in microbiology and infectious diseases, and Dr. Aasem Chaudry, who is consultant urological surgeon and member of the vaccination team. The way this Zoom event will happen, each doctor will currently get 3 minutes in English just to explain what they are doing as part of the COVID-19 vaccine teams, and 1 minute in their native language, which will be Urdu, Punjabi, and Bengali, I believe. After that, we're just going to jump straight into the questions. We received a lot of questions, so thank you for everyone who sent in their questions. We've tried to group them as best as possible, including some of the interesting questions like, does the vaccine have microchips and things like that? So I'll pass it over to Dr. Aasem first.
My name is Aasem Chaudry, and I'm a consultant surgeon and doing urology at Bedford Hospital for the last 10 years. I have been in hospital practice for over 30 years. 20 years of that time has been spent in the NHS. And I've been involved in the vaccination program as implemented here locally in Bedford. We'll talk about the questions, and there are a lot of myths that, as mentioned earlier, which are going around. We'll try to address them. But before I think we do that, over to Dr. Azher for introduction. So, Dr. Azher.
Dr. Azher.
Thank you. I'm Muhammad Azher, one of the respiratory consultants. I have been in respiratory medicine practice since 1990, but before that I have done general medicine for about 10 years. I actually want to briefly inform you about the infection and how it spread, because it's very important to understand how the infection spreads in the community. The infection symptoms usually are very mild in the beginning. In the first 3 days, you have symptoms of upper respiratory tract infection, maybe just stuffiness in the nose and a little bit of sore throat or something. At that stage, people are actually spreading the disease, and it is very important to realize there and then that you should protect your family. So the test is done. People, when they do the test, it may take 48 hours to get the result, but it is better to continue the precautions unless the test result has come back as negative. It is a viral infection. It is different than the usual flu and cold because this is an infection which is quite serious, and it can cause severe problems relating to all systems in the body. So because it spreads through your airways, it comes in the air and touch. So it's very important to take precautions breathing air in the area, even if you are closer to somebody and you don't actually become very close to your family members. If you are within the same room or sharing the things like utensils, cooking, the touching clothes and things, this it can spread through your touch on the hands. So it's very important to follow the regular cleaning and washing your hands, or you should also be using, if it is possible, to use the alcohol. Then after that, if you want to, you can wash the hands afterwards. Alcohol is far better to kill the virus than the soap. If you use soap, you have to do it for at least 20 seconds and prefer to do it twice. So it's very important to reduce the spread within the family, within the community, to your friends and the loved ones. How to recognize the early symptoms is usually you feel unwell, like body aches, headache, a little bit of stuffiness in the nose or throat. Loss of taste and smell is one of the very early symptoms. You are spreading the virus for about 14 days after you have started the symptoms. So it is very important to take precautions for 14 days if anybody has those symptoms. The other important thing is not everybody will be ill enough to go to the hospital. If you have an infection, it is safer and best to stay at home, isolate yourself, wear a mask, maintain 6 yards or 2 meter distance, preferably more than 2 meters distance within your contact, and don't use the things which have been touched by the patients. So this is important. That will definitely reduce the spread within the family. If you develop shortness of breath with the problem, it is important to go and get the medical advice, because the commonest cause of serious illness and death is the breathing problems. I would recommend that if somebody in the family develop any shortness of breath, it's best to take a pulse oximeter, which is you can buy from any pharmacy. It's only about 20 pounds, and you can monitor your oxygen every 4 hours. And if it goes below 94% on it, then it is best to present to accident emergency or emergency services to get some advice, because that is when you need steroids as the medications. Earlier in the disease, simple precautions, taking vitamin D and vitamin C along with good fluid and hydration may be good enough, and you do not need to take any steroids. Antibiotics can be prescribed by the GPs, but their role is limited until you develop respiratory problems. If you don't develop breathing problems, then antibiotics are usually not needed. So important is to monitor the heart rate and oxygen. And if heart rate goes above 120 and your oxygen saturation goes below 94, please do go to the hospital and see the emergency things. I think I don't want to go into the detail of the illnesses because it is a serious illness. I would advise all of you to take every possible prevention to look after yourself as well as to the people who are your loved ones, particularly the people are on risk who have comorbidities and any other diseases. Now, in 1 minute, I just want to mention in Punjabi, ਕੋਵਿਡ ਇੱਕ ਐਸੀ ਬਿਮਾਰੀ ਹੈ ਜਿਹਦੇ ਨਾਲ ਬਹੁਤ ਜ਼ਿਆਦਾ ਲੋਕ ਮਰ ਜਾਂਦੇ ਹੈ ਇਸ ਲਈ ਕਿ ਇਹ ਪੂਰੇ ਜਿਸਮ 'ਚ ਬਿਮਾਰੀ ਫੈਲ ਜਾਂਦੀ ਹੈ ਔਰ ਬੜੀ ਜਲਦੀ ਫੈਲਦੀ ਹੈ ਪਹਿਲੇ 3 ਦਿਨ ਤੋਂ 14 ਦਿਨ ਬਹੁਤ ਸੀਰੀਅਸ ਹੁੰਦੇ ਆ ਉਹਨਾਂ ਦਿਨਾਂ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਕੋਸ਼ਿਸ਼ ਕਰੋ ਕਿ ਦੂਰ ਰਹੋ ਇੱਕ ਦੂਸਰੇ ਤੋਂ ਮਾਸਕ ਪਾਓ 2 ਮੀਟਰ ਤੋਂ ਜ਼ਿਆਦਾ ਫਾਸਲਾ ਰੱਖੋ ਕਰੀਬ ਨਹੀਂ ਜਾਓ ਮਰੀਜ਼ ਦੇ ਔਰ ਦੂਸਰਾ ਮਰੀਜ਼ ਨੂੰ ਬੈਸਟ ਹੈ ਕਿ ਕਿਸੇ ਇੱਕ ਸੈਪਰੇਟ ਕਮਰੇ 'ਚ ਹੋਏ ਸੈਪਰੇਟ ਟਾਇਲਟ ਇਸਤੇਮਾਲ ਕਰੇ ਤੁਸੀਂ ਕੋਈ ਚੀਜ਼ ਟੱਚ ਕਰੋ ਹੱਥ ਆਪਣੇ ਸਾਫ਼ ਕਰੋ ਅਲਕੋਹਲ ਯੂਜ਼ ਕਰੋ ਔਰ ਉਹਦੇ ਬਾਅਦ ਉਹਨੂੰ ਸਾਬਣ ਦੇ ਨਾਲ ਸਾਫ਼ ਕਰ ਲਓ ਉਹਦੇ ਇਲਾਵਾ ਸਭ ਤੋਂ ਜ਼ਰੂਰੀ ਚੀਜ਼ ਹੈ ਜੇ ਕਿਸੇ ਨੂੰ ਬਿਮਾਰੀ ਹੋ ਜਾਏ ਤੇ ਆਕਸੀਜਨ ਆਪਣੀ ਚੈੱਕ ਕਰੋ ਮਸ਼ੀਨ 20 ਪਾਉਂਡ ਦੀ ਬਾਜ਼ਾਰੋਂ ਮਿਲ ਜਾਂਦੀ ਹੈ ਅਗਰ ਆਕਸੀਜਨ 94% ਤੋਂ ਥੱਲੇ ਹੋ ਜਾਏ ਜਾਂ ਹਾਰਟ ਰੇਟ 120 ਤੋਂ ਉੱਪਰ ਹੋ ਜਾਏ ਫਿਰ ਹਸਪੀਟਲ ਐਮਰਜੈਂਸੀ ਡਿਪਾਰਟਮੈਂਟ ਜਾ ਕੇ ਆਪਣੇ ਆਪ ਨੂੰ ਚੈੱਕ ਕਰਾਓ ਕਿਉਂਕਿ ਤੁਹਾਨੂੰ ਫਿਰ ਸਟੀਰੋਇਡਸ ਦੀ ਜ਼ਰੂਰਤ ਹੁੰਦੀ ਲੇਕਿਨ ਸਭ ਤੋਂ ਖਤਰਨਾਕ ਚੀਜ਼ ਹੈ ਜਦੋਂ ਤੁਹਾਨੂੰ ਪ੍ਰੋਬਲਮ ਸ਼ੁਰੂ ਹੋਏ ਤੁਹਾਨੂੰ ਜਿਸਮ 'ਚ ਦਰਦ ਹੋਏ ਜਾਂ ਹੈਡੇਕ ਹੋਏ ਜਾਂ ਤੁਹਾਨੂੰ ਪਤਾ ਲੱਗੇ ਕਿ ਤੁਹਾਡਾ ਨੱਕ ਔਰ ਮੂੰਹ 'ਚ ਪ੍ਰੋਬਲਮ ਮਹਿਸੂਸ ਹੋ ਰਹੀ ਕੋਈ ਸ਼ੋਰ ਹੋ ਰਿਹਾ ਜਾਂ ਤੁਹਾਨੂੰ ਪਤਾ ਲੱਗੇ ਤੁਹਾਡੀ ਸਮੈਲ ਖਤਮ ਹੋ ਰਹੀ ਤੇ ਫੌਰਨ ਆਪਣੇ ਆਪ ਨੂੰ ਆਈਸੋਲੇਟ ਕਰ ਲਓ ਔਰ ਦੂਸਰਿਆਂ ਤੋਂ ਪਰਹੇਜ਼ ਕਰੋ ਆਪਣੇ ਲਵਡ ਵਨ ਨੂੰ ਬਚਾਓ ਔਰ ਉਹਦੇ ਲਈ ਜ਼ਰੂਰੀ ਹੈ ਕਿ ਤੁਸੀਂ ਜਿਹੜੀ ਵੀ ਪ੍ਰੀਕਾਸ਼ਨ ਲੈ ਸਕਦੇ ਹੋ ਇਸ ਬਿਮਾਰੀ ਨੂੰ ਬਚਣ ਵਾਸਤੇ ਉਹਦੇ ਤੇ ਅਮਲ ਕਰੋ ਥੈਂਕ ਯੂ
Thank you, Dr. Mansoor.
So, thank you very much. So, my name is Mansoor Raza, and I'm a consultant in infectious disease and microbiology at Milton Keynes University Hospital. I've been doing infectious diseases for nearly 25 years now, roughly last 20 years in the UK. So what I'm going to talk about is about the vaccines. So I'll give you a brief idea of what vaccine is. So vaccine is a type of medicine that trains the body's immune system so that it can fight a disease it has not come into contact with before. So it's used as a preventive tool to prevent people from getting a disease rather than to treat a disease once you have caught it. We've had vaccines for a long time now, going back to the discovery of the smallpox vaccine, and although people do talk about experimental vaccines and things like that, all vaccines or all drugs have come out of experiments. So we research is the way we we get new drugs, we get new vaccines, and that is how the COVID vaccine has come about as well. So there's nothing new about how we've got the vaccine for COVID as well. Just to put things into perspective again, the vaccines that we've had over the years, different vaccines have had different efficacies. And by that, I mean, some have a greater chance of protecting people from catching the disease, and some have less. And again, it not only depends on the particular vaccine, but also depends on the immune response of the person who's being given the vaccine. So if somebody's immune system is not very strong, even if you get the same vaccine, which is supposed to be very effective in somebody else, it may not be that effective in somebody who's got a immune system which doesn't respond very well to the vaccine. Because what vaccines essentially do is, we inject something into the body, either a part of the bug that we want to protect against. It could be a live part. When we use a live part, we actually make them a bit weak so that they don't cause disease, but they still stimulate the immune system. Or we put a part of a dead part of the bug itself, or very rarely in the past we've used something which we have synthetically manufactured. And the new COVID vaccines, two of them are examples of a synthetic manufacture rather than using, in fact, all the three that have been licensed in the UK are using genetic material rather than bits of the virus themselves. So I'm sure people have seen pictures of the coronavirus. It's got all these things sticking out, and these are the spikes, as we call it, and it's the spike protein which is what is stimulating the immune system to produce antibodies. And these antibodies are what are called neutralizing antibodies. So if the body has got antibodies against the spike protein, when the virus enters the body, the antibody is going to attach to these spike proteins and prevent the virus from carrying on multiplying and causing a problem in these people who get the virus. So that's the idea of giving the vaccine. And now what happens with the mRNA vaccines, the Pfizer vaccines and the recently approved Moderna vaccine is, there is a lipid nanoparticle, it's called, which is a shell, if you like, in which the mRNA instruction is put in, and then it goes into the body and it instructs the body to synthesize or make the spike protein. And once the spike protein is produced inside the body, then the body's immune system reacts and causes production of the neutralizing antibody I was talking about. So that is how the mRNA vaccines work. The Oxford vaccine or the AstraZeneca vaccine is different in that what we use, instead of using the lipid nanoparticle, which is used to cover the mRNA instruction or the gene, we use an adenovirus vector. So basically this is an adenovirus. Now adenoviruses are very common. We routinely get infections with adenovirus. Usually it causes a type of cold, but because we don't want to mix the body's immune response with the response we've already got to the human adenovirus, what the researchers have used in the case of production of the Oxford vaccine is an adenovirus which affects the chimpanzees. So I'm sure people have heard about swine flu, bird flu. So these are different types of flus which have caused problems in the birds or in the swine population. But we know with flus, they have actually gone on to affect humans as well. But with adenovirus, the chimpanzee adenovirus hasn't caused problems in humans, and therefore it is easier to use that and not confuse the immune system. So basically the adenovirus, the chimpanzee adenovirus. So it's not anything to do with the chimpanzee itself, but the virus which causes infection in in the chimpanzees is isolated, and this is then made a bit weak so that it does not multiply when it enters the human body. But inside the adenovirus, we put the gene which is coding for this spike protein. And when it goes inside the body, it does the same thing. It produces the spike protein like the mRNA vaccine does. And then the body responds by producing the antibody and helps fight the infection when people get exposed to coronavirus. So that is the mechanism of action, if you like. So I'll tell you a bit more about the three vaccines as to how much testing has been done and what is the effectiveness. So the Pfizer vaccine was trialed on 36,000 patients, nearly over 36,000 patients. Now, half of them were the ones who were given the vaccine and half were not given the vaccine. They were given placebo, and it was found that it was 95% effective after people were given the 2 doses of the vaccine 3 weeks apart. With the Oxford or the AstraZeneca one, there were more than 11,000 people who took part in the trial. And again, it was 50-50, 50% were given the vaccine and 50% were given placebo. Here, the effectiveness was found to be 70.4%. The Moderna vaccine, again, quite a large number of participants, 30,000 plus, and the effectiveness was 94.1%. So all of them, looking at, the vaccine efficacies that we've had with other vaccines in the past, these are very good effectiveness data that we've got. So they are supposed to work and work quite well compared to previous vaccines that we've had. Now, I just want to take a little bit more time about just mentioning the different groups. So in the UK, the decision has been made by the joint vaccine community on vaccination and immunization to divide the priority into 7 groups of people. So the first priority group are people who are residents in a care home and staff working in care homes. The second group is all those 80 years and above and frontline health and social care workers. The third group is over 75. Then the fourth group is over 70 plus people who are considered to be clinically extremely vulnerable. So people who are more likely to be having severe disease if they catch it are the people who are going to be offered this vaccine. I'm not sure about the situation in Bedford, but I do know that in Milton Keynes, people in that category are now being offered the vaccine, which is good news that we have gone down to the 4th priority group in Milton Keynes. And then we go on to people over the age of 65 in the 5th group, people between 16 to 65, but who are in the special risk group. So people who would normally get offered the flu vaccine are considered to be part of that 6th group. And then number 7 group is all those 60 years of age and over. And I think after this whole group of priority patients are covered, then it will be rolled out to the rest of the population. So I think I'll end my talk here, but I'd like to take some time in speaking in Bengali and just summarizing what I've said.
Dr.
Um,
Mansoor, sorry, just because of time, could we possibly leave that till the end just in case?
yeah, that's fine. We
Yeah?
can answer in Bengali if anybody has a
Sure,
specific.
okay. So we're going to get right into the questions. I'll let you guys decide who would like to go first. So before we get into the vaccine questions, there was a question about the government initially when it started said if we don't go above 20,000 deaths, it would be a good thing. Now we've obviously, unfortunately, passed that. The question was, what is herd immunity and why was this a strategy if the death rate could have been so high, which obviously it still is? Are we still in the herd immunity phase, or are we trying to go down to a zero COVID phase?
So if you want, I can answer that question. So I think it was a very brief period when I think probably I heard it on the media for just 1 or 2 days about this strategy. And I think very soon people who were talking about it realized that this was not an option. So basically, herd immunity means protecting the population either by giving lots of vaccines or by lots of people having the infection itself. So the other word for herd immunity would be population immunity. Now, if a disease was causing deaths, causing problems with the healthcare system being overwhelmed, you could not go down the route of letting lots of people developing the infection and then the population getting sort of protected because of lots of people having had the infection. And that is exactly why this was very quickly abandoned, because the proposers of this strategy realized that there was lots of illness happening and there were deaths happening, and given the experience we were having from Italy at that time, we were worried about the NHS being overwhelmed, and therefore this strategy was abandoned.
Okay.
If I can add to this,
Yeah.
Mansoor has explained it well. In fact, you have to have almost 80% of your population being affected by the disease to develop the immune system to be able to reduce the mortality. So that means 80% people will develop the infection and get the immunity from the infection. So that herd immunity, what people feel about is not a route which is clinically and medically can be followed. So it's a, people think that, okay, if we wait, there will be herd immunity, but will be lot of deaths during that.
Yeah. Which we're currently seeing, yeah, no, sure. Some repetitive questions that were coming up was around babies, vaccine, and pregnant women. So we know pregnant women, from what I understood, they weren't part of the trials. Are pregnant women part of trials for vaccine? Would this be safe for children?
I think, can I answer this question? Yeah. So far, pregnant ladies and breastfeeding ladies, we don't recommend the vaccine at this stage. But if somebody is planning a pregnancy after a year, then it is safe to take the vaccine. Because the pregnant ladies and breastfeeding, unless there is no trial in it, and like every medicine, it may be safe, we don't know, but like every medicine, we do not recommend giving to the people unless we have an established trial on it. So it will not be offered by the NHS to the pregnant ladies at this stage.
And with other vaccine trials, I guess pregnant women aren't included generally in the trial phase, which I guess if you look at the back of a lot of boxes of medicine, it generally says if you're pregnant or breastfeeding, avoid or speak to your GP.
Yes, I mean, of course, the vaccines, we try not to include them because we do not know what will be the effect to the fetus, of course, to the baby.
Yeah.
It is very important that we don't, unless Mansoor wants to add
Yeah,
any.
so I think the JCVI, the Joint Committee of Vaccination and Immunization, has looked at it further. And yes, you are right that there are no trials, and therefore we can't say that the vaccine is going to be safe in pregnancy, and therefore we can't recommend routine use in pregnancy. However, just because it is an inactivated or recombinant vaccine, there isn't a potential risk that we are aware of. And therefore, what JCVI is saying is it can be considered in certain high risk scenarios. So say, for example, somebody had a condition which made them immunosuppressed, or there were other risks. They were in a high risk category, not just because of the pregnancy, because they had some other condition and they were pregnant at the same time. So in that scenario, there has to be an individual discussion between the pregnant lady as well as the doctors or the obstetrician or the clinicians looking after her against the risk and benefits, because there will be a double risk, if you like, and that needs to be discussed on a case-by-case basis. For breastfeeding, again, they are a bit more relaxed about it, because there is no, because it's a killed vaccine. There isn't a risk of anything passing on to the baby. So COVID-19 vaccines can be given to breastfeeding women if they are eligible for it.
Okay.
Can I just add regarding children, the same principle applies, as it has not undergone trials on children as yet. So this is the reason it is not recommended for children, especially under the age of 18.
And for one other reason, fortunately, children immune system works slightly different than the adult immune system because they're young cells, so their immune response is good, and the disease in children, fortunately, is milder than what the disease in adults is. Although, I mean, there has been few deaths in the children also, but not like the seriousness as for the adults. So that's another, I think, another important point for people to realize. That is
Children,
why
yeah.
we taking age by age, because the risk is more towards the older you are, the
Yeah.
risk is higher. And if you have any other disease, which any other serious heart, lung, kidney disease, or you have diabetes, you are at a higher risk of developing
Sure.
the infection and the cause of, and it's causing death. Yeah.
So we've got a healthcare worker who works at Bedford Hospital. They've said they would like to take the vaccine, but they don't know the difference between, for example, the Oxford one and Pfizer. Will there be a choice, or does it matter which one you take?
I think as far as I'm aware, this is not by choice. Both vaccines are quite effective, as Dr. Mansoor earlier explained. And in terms of choosing the vaccine, I don't think NHS can offer choice to the people at large of choosing the vaccine, which one they want, because both the vaccines are based on the trials which have already been done, safe and effective.
Okay, that's great. Moving on to an interesting question. Do vaccines have chimpanzee DNA? So I've seen Facebook posts where people are saying apparently the AstraZeneca one has chimpanzee DNA in it. So could that be clarified?
Yeah, so as I said earlier in my introductory bit, that the chimpanzee thing is nothing has been taken from the chimpanzee. So basically, the virus which is used to transport the genetic material into the body is an adenovirus. So, but the virus, the adenovirus affects different people as well as different animals. What they have done is they have just isolated the virus from the chimpanzees. So by that I mean that, so if I had an infection with a virus, if you took my, say, sputum sample or, swab, you can actually grow the virus itself separately in the lab. And when you grow the virus, you just collect the virus. You don't have any DNA of mine growing on that plate or on that liquid culture that is usually used in for viral cultures. So similarly, the chimpanzee connection is not with the virus. The adenovirus is just obtained from chimpanzees, and the virus should not have anything from the chimpanzee itself.
So this is a lesson for people who possibly read and take a statement without actually having an understanding. So it's important that we ask the professionals about this. Okay, great. So moving on from that, around the use of vaccines, I know you mentioned some of the things earlier. What diseases have been eradicated by the use of vaccines, or at least controlled to a point where they're not as active as when they first came in?
So I'll take this one as well. So as I have said earlier in my introductory bit, that smallpox vaccine was one of the first ones to be discovered, and smallpox has been eradicated from the world by using the smallpox vaccine. So much so that we don't need to use that vaccine anymore because we don't have smallpox. So the last case was actually a lab incident because we were keeping this virus in one of the labs. There was a lab accident, and a laboratory worker got the infection. So yes, vaccination can eradicate infections. The other infection which most people would have heard of is polio, and we are very close to, in fact, we've eradicated it or eliminated it from a lot of countries. It's just in some countries in Asia that we are almost at the point of, eliminating polio as well. But it's something which is proving very challenging. We are nearly there, but not there yet. So we can eradicate infections with vaccinations.
Yeah, do you feel that there's a apprehension around vaccines because of, for example, people used to equate vaccines with autism and things like that? Do you think there's a natural apprehension towards vaccines, especially with something that's come out so quickly?
So again, the problem with some of these theories is it's very difficult to establish a causal link to some of the conditions that people see to vaccine or something else even. So we sometimes hear drugs being, some medications being implicated as well. And unless we can scientifically demonstrate a causal link, I think it would be unfair to blame a product or a medication for causing it.
We just add that we're saying at present, there is no evidence of any such link. However, having said that, we have to accept that the long-term effects of this vaccine are still not known. So it's a matter of risk assessment and then making an informed choice because COVID is a deadly disease, as we know. It has caused over 2 million deaths already in the world, and the number is rising. So it is not something which is a theoretical risk, but it is we are seeing death all around us. So that is why, based on the previous data that we have of other vaccines, we can extrapolate and say it is safe to our knowledge, but nobody can guarantee it 100% at this stage.
I think if I may add something here, we have tried to explain, and I think the reason for that is the particles which are used for the Moderna and Pfizer vaccine, they clear from your body very quickly. So they are unlikely to do any long-term damage. You just produce the antibodies to that material, and that material is just, it degraded, it just disappears from your blood within about 48 hours or so. So it's not something which stays in your body for long term. So I think people should realize that obviously we cannot be 100% sure unless the vaccines is given and for a few years you wait. But there is no scientific basis to believe that it can do any long-term harm to the patients.
Okay, that's good to know. One common question that's coming up, which is around Facebook as well, is can this vaccine alter your DNA?
Simple answer to that is no.
Okay. We'll
Yes.
leave
It
it at
doesn't
that.
get attached to your DNA anyway. So
Yeah.
Yeah. Okay. The other one was, I know you briefly mentioned it. When is the vaccine available for the general public? Is it after all those phases and all the people in the high priority groups been with? And is there a timeline
Yes.
for this?
So can't remember exactly, but I think I've heard it's the summer, isn't it, Dr. Chaudhry?
Yes, I think that's right. It will, I think the supplies are also, because this is all very new for the whole world. The supply chains are not as well established, and the different vaccines have different requirements for them to reach the end point. And based on what information we have, it is likely to go on for this year. Towards the end of this year, I think we should be able to vaccinate the entire population, but it will follow a protocol that I think Dr. Mansoor Raza earlier referred to. High risk groups first, then the elderly age group, and then the age will keep coming down as we go along.
Okay. There was a question obviously around the vaccine and new variants. So I read and from an epidemiologist who said apparently there's 12,000 variants already. Therefore, will this vaccine A, work against the other variants, and B, if it doesn't, does that mean we'll need a kind of booster shot every year, like we have a flu jab yearly?
And Dr. Mansoor to answer this.
Yeah. So the reason, so this COVID virus is a RNA virus, and what all viruses do when they enter the human body and they make copies of themselves. And during this copy making process, they sometimes make errors. So although with other bugs, when we talk about antibiotic resistance, it's actually triggered by use of antibiotics that the bug changes or mutates. In most RNA viruses, it happens as a natural process of their multiplication, that there are mistakes made, and you get more mutations. Now, not all mutations will be significant, and therefore, although as you said earlier, we've had so many thousands of mutations, we only heard about the ones which are actually having a clinical impact. So the UK strain, the clinical impact it has had, or it has been shown, is that it is more transmissible. There is some concern now whether it is causing more mortality as well. So unless it leads to a clinically relevant impact, these mutations may not be of much meaning to us as the people getting affected by it. The other part of the question was about vaccines working. And again, as I said, the idea is to, bind the virus, and because the spike protein is the one which is all around this virus, and that is the antibody we are trying to produce by using these vaccines. So unless the spike protein itself disappears from the surface of the virus, then these antibodies will not be able to attack the virus, if you like. And that's very unlikely to happen. And again, there is some data from Pfizer to suggest that certainly the Pfizer vaccine, they've done some further work to show that it is effective against the the UK strain and the South African strain. We don't know about the other two strains that we've been hearing about from Brazil and other places.
When they mutate, why does the virus not become weaker as it's mutating?
So some of them will become weaker, and that's why. But we want to know about them because they wouldn't be actually doing. So yes, it can happen that we might end up with a weaker strain, and that means it will still persist but not cause the havoc that it is causing. But we don't know whether that will happen. And again, it's always whenever there is competition between different viruses, it's the stronger one or the more transmissible one which actually overcomes and wins the race. And that's why this one, the current one, because it is more transmissible, is now the main strain within the UK.
I think if I may add something here,
Yeah.
COVID is RNA viruses, COVID type is not the first one to appear. Similar viruses have had caused the disease earlier, like bird flu and all those. They were similar, but what happened? The virus became weaker. Now this virus has come out stronger. So maybe after a couple of years, you never know, this virus may become so weak that it will not cause the disease. But you may have to have vaccine for a different virus then. So I think this fight between the humans and the viruses will go on. Like flu vaccine, you take it every year. This virus may go weaker, but you may have a vaccine for a different virus.
Yeah.
So I think the people should not think that once you have taken the vaccine, it will cure the disease for rest of your life or something.
Okay. Slightly more technical question, but it's basically around fetal cells. So the AstraZeneca vaccine uses HAK293 human kidney cells, which is one of numerous aborted fetal cell lines used in vaccines. How can their use be deemed halal, which is the first part, and why are these present?
I think the first thing we need to understand is that none of these vaccines have any element of any animals in them. Now, as part of the development process or as part of the research, almost all the vaccines start by animal experimentation or experiments on different types of living tissues. And fetus cells are sometimes used at that stage. So that could be a part of development of a vaccine. But the vaccine, once it is used and finalized, has got no relationship with that tissue other than that was used in research.
Okay, and for the vegan society, I don't know if this was looked
I think it's the same thing applies there, as I said earlier, that none of these vaccines have any animal component in them.
Okay.
So they are perfectly suitable for the vegans and completely halal for Muslims.
Excellent. Okay. Repetitive questions around when you get the vaccine. Firstly, why has the dose been spread out? So we know it was meant to be within a certain time frame. It seems like the UK government possibly also went against the advice of SAGE and have separated it as 12 weeks, even though WHO themselves said it should be closer than that. Is there an issue with this, or is it literally experimental in the midst of the pandemic?
So again, I will admit that this decision is more a public health decision. And in simple words, what public health are thinking of is the greater good. Yeah. So the idea is to give a high level of to give protection to a higher number of people um, to prevent more deaths and hospitalization than vaccinating a small number of people with 2 doses. So that is the overall drive which has guided the UK government's decision. Now, they have used some scientific evidence to use this sort of approach, in that both the mRNA vaccines as well as the Oxford vaccines, um, they have dissected the data which was produced by these studies. So the Pfizer vaccine, after first dose, the protection is supposed to be 90%. Whereas with the AstraZeneca, again, after the first dose, the protection is at around 70%. So they have used this to say that if we use just one dose, we can vaccinate a larger population, and therefore we must understand that when this decision was made, the number of hospitalizations were going through the roof. Hospitals were at breaking point, and obviously the mortality is still on the rise in spite of the lockdown, in spite of the vaccination drive. What I can't say for sure is whether there will be an adverse outcome from this decision making, i.e., by not giving the second dose at the prescribed time for these vaccines, whether we are going to lose out on developing more sustained antibody response. Only time will tell. But given that when we look at people who missed doses for one reason or the other, and subsequently have had the dose later on, we do find that people do respond with antibodies where we test them. So I think time will tell, but again, I can't guarantee, but I can understand or explain the reasoning behind the approach. And obviously it was because UK was in a very unique situation.
I think if I may add there,
Yeah.
the evidence was the antibodies are produced, but you have the memory cells. So if somebody gets a virus, they will still produce the antibodies from their memory cells. So there will
Right.
be some advantage of giving one dose rather than you mean, as everybody knows, that the protection with the vaccine is not 100%. People can still have the disease, but it is definitely evidence that the disease will be much milder after even the single dose of vaccine. So it is still a good protection. That is the reason to delay it so that you can do it to more people. So supply is an issue which hopefully may be addressed sooner than what is expected.
Okay. We're going to move on to a key area which a lot of people have been worried about. It's the adverse reactions. So I believe something that I read in America is they had around 7 million vaccines given out to 3,000 adverse reactions. There's obviously the article going around about Norway and the 23 deaths, or maybe it has increased to 30. A lot of people are worried about having a reaction. So could we touch upon what reactions you could get from this vaccine, but also how you can get a reaction from other medicines, antibiotics, and vaccines in general?
So
Yeah. Go on.
shall I?
Yeah.
Yeah. So again, the the common side effects that we see from all three of these, we've seen in the trials of all three of these vaccines, are actually not very different from other vaccines. So most vaccines will give you a local injection site reaction, and either pain or sometimes swelling, or sometimes even redness. People get some general symptoms, and these are basically a sign of the immune system actually responding to the new thing that has been injected into your body, and that is part of your immune system actually developing the immune response to develop antibody. So these include, feeling a bit tired, headaches, muscle pains, and sometimes you can even have chills and fevers. So these are the common side effects which are seen with other vaccines, and they are certainly seen with these vaccines as well. Um, um, but there have been a few other uh, adverse reactions, some neurological. But again, when the data was looked into deeply, it wasn't out of the ordinary in terms of the incidence of these problems in the general population. So it may have been a coincidence that these people developed that sort of illness after having the vaccine. So there isn't anything which is glaring out to say, well, you need to accept this sort of side effect if you want to have the vaccine. Sometimes we do say that for certain medication that you will definitely have this side effect and you need to be prepared to accept this side effect. But with all these three vaccines, apart from the general common vaccine side effect that I have mentioned, uh, most people will not get these other side effects.
Dr. Mansoor, if you could just, sorry, if you could just partially also answer that in Bangla, please. We've got someone on the Facebook who's asking, similarly, some people are dying after vaccination. Is that true or false? If you could do it in Bangla, please.
So just I'll answer it in English first about the death. So again, I think the news about the deaths seen in, I think these are primarily elderly people. Again, I don't want to go too much into it because I haven't seen any details about what the government there has made out of it. But I'm told these were elderly patients, and there could have been other causes for the death. So I think we need to wait for the outcome of the investigations locally before we comment on it. So I'm going to talk about the adverse effect events now in Bangla. So বেশিরভাগ ক্ষেত্রে যে সাইড এফেক্ট আমরা দেখছি সেটা অন্য ভ্যাকসিনের ক্ষেত্রেও দেখা যায়। সো একটু যেখানে ইনজেকশনটা দেওয়া হয়েছে সেখানে একটু ব্যথা, একটু সোয়েলিং, একটু গা ব্যথা, মাথা ব্যথা, একটু সামান্য জ্বর, গাঁটগুলোতে একটু ব্যথা, এইগুলো কমন সাইড এফেক্ট যেটা আমরা অন্য অন্য ভ্যাকসিনের ক্ষেত্রেও দেখি। কিন্তু তার ছাড়া কোনো স্পেসিফিক সাইড এফেক্ট আমরা অ্যাজ আ দেখছি না এই তিনটে যে ভ্যাকসিন যেটা ইউকেতে ইউজ হচ্ছে, যেটার জন্য আগে থেকে আমাদের চিন্তা করতে হবে। থ্যাংক ইউ।
Would anyone want to add anything extra?
Any other specific questions which you have received?
I think regarding the deaths, I'll just add on to this, the total number of people who have had this vaccine is well over 20 million around the world now. And that's quite a large number.
Okay.
And there has been so far, I think 40 or 50 severe acute reactions reported. So which, if you look at the percentage, is extremely small, and none of these patients who developed acute reactions died. So they've all were saved with the emergency treatment. So when you use any antibiotic injection, for example, there is a risk of having an anaphylactic reaction.
Yes.
So that reaction risk is still there with this vaccine as well, but the risk is so small, as I said, 40 out of 20 million is you can see how small the risk is.
Very.
You can't say there is no risk. So we have to inform the patients. Every patient who gets this vaccine is informed about the risk and he consents to accept it before the vaccine is given.
And if I may add, that is why patients are asked to wait for half an hour after 20 minutes at least. So most people who developed an allergic reaction, they developed within the first 20 minutes too. So that is why they were managed. If you manage them adequately, the deaths go down significantly to negligible number.
Yes.
That is what it is.
Yeah.
Okay. We have a few questions left, so if I can try and get through them a bit quicker, the audience aren't holding them. So really quickly, GPs and profiting. Apparently, you're getting £12.50 for each vaccination that is administered. Is this a profit for GPs, and are you then, because of that, pushing people to become vaccinated?
I think you want me to answer this. I suppose this is not something we should be concerned about, because the GPs are being paid for extra service, because this is the service they are doing on top of their normal duties. So it's not something they will push for to get the money from the patients or from the NHS. So I think this is not for the community to worry about. This is the government's initiative to get more people to be able to do it, because each patient will take about half an hour to do the vaccination. So
Okay, yeah.
it's nothing to do with the profiteering out of it.
And
Just
on the flip side, I can confirm that, for example, the vaccination service at Bedford Hospital is being run by voluntary services for all the doctors.
Yeah.
I'm one of them. We do provide the service in addition to our normal work without any charge. So I think there is a lot of voluntary work happening behind the scenes. I don't think anyone is making money out of this vaccine or vaccination program.
But obviously, GPs have been given initiative from the government.
The government, yes, that's right.
Yeah, because they have to make extra arrangements for it.
For it, yes. Their situation is different.
Yeah.
yeah, and again, just to highlight on the same note, I've heard of GPs volunteering at the main, because in other parts of the country they are doing vaccinations in big sports hall and stadia, and GPs are volunteering there rather than being paid for their services. I know people who've retired have come out of retirement just to help with the vaccination program. Hospital doctors have volunteered in these centers as well. So they're all adding to the capacity to vaccinate people out of their own good, and that should give people the confidence that this is not about money. It's just about how strongly people feel about the need for people to get the vaccine.
Oh, yeah. Yeah, okay. We've got some question on Facebook. What are your views on the recently published article by The Guardian, which referenced an Israeli official who stated that the Pfizer vaccine was only 33% effective?
I think I'll respond to that. I think in media and in press, there are a lot of things coming up because it is a hot topic. All this data is not verified at this stage. And I think we will have much more reliable data in a few months' time. So it's too early to make such comments on the efficacy, etc. As I said, there are millions of people who've had it, and in a few months' time, we will know the results. But the important thing from the public perspective is that all these three vaccines, which we are using in the UK, have been shown to be safe so far. How exactly what is their efficacy and long-term effect on the disease, only time will tell, inshallah.
No, but if I may add here, I think that sort of data, which is given it is effective on 33%, is saying that the people developed an infection even after taking the vaccine. And that is possible.
Yeah, that is possible.
But it will be much milder an infection rather than a serious infection. So people should look at from that point of view, rather getting to the negative propaganda that it is, because no vaccine is 100% protective anyway.
Yeah. Just moving on to, I guess, the pandemic. I'm just trying to look at Facebook at the same time. If we can move on to the PCR testing and even the lateral flow test. So someone's asked if the whole pandemic was based on positive cases by using the PCR test, and now that the WHO has issued advice that the PCR cycles threshold used was too high and should not be used as a sole diagnostic tool. Symptoms displayed should be looked at as well as other diagnostic tools. So, if the PCR test is not reliable, then was there or is there a pandemic?
So,
I think Dr. Mansoor, can you comment on this?
so well, there is a pandemic.
Yeah.
So from my point of view as an infectious disease physician, I do not believe any results if it doesn't make any sense. And certainly with the PCR result, which is a DNA test, or in this case an RNA test, you can always pick up bits of the virus which will be there for a while and may not represent. So when people say to me, oh, I had the infection, I had a positive PCR test, and 2 weeks later or 3 weeks later, I had another test and I was still having the virus. So I say to them, you probably didn't have the virus, but you had a bit of the genetic material of the virus, which was still isolated. Because if your symptoms had gone and you were feeling well, the problem which is there is actually being very dogmatic and saying to these people who test positive weeks down the line that they should actually be self-isolating because they've still got the virus. Well, I can't say to them that they've still got the virus. They still have the genetic material, but the virus is probably dead or gone by then. So yes, there are challenges with the diagnostics, but not at the level that we uh, don't accept that there is a pandemic. There is, so we are not only seeing, in fact, when the pandemic was, at least in the UK, most people weren't getting a test done. People were being, getting symptoms, and only the ones who were coming into hospital with those symptoms were getting the diagnosis confirmed by this PCR test.
Okay, and the lateral flow test, because at my workplace they've given us a box where we have to get tested twice weekly, but they say that those are only 40% effective. So is it just a tool? Can you get to the PCR test, or?
Yes. So again, it's because it can be done by the individual, and it can be done very quickly, whereas the PCR test is taking a long time. We've even now begun to use it in A&E setting, because what we want to do is, so a negative test may not always be reliable, um, um, and therefore, at least in our hospital, what we do in A&E is, if the test is positive, we assume that the PCR will confirm it, and we start isolating that patient. But if it is negative, then we still wait for the PCR test. But then we deal with that patient whether to isolate or not based on their symptoms. So if they've got symptoms of COVID, then you have to isolate whether the lateral flow is negative. And even sometimes we do that even with PCR negative patients if we are really concerned that they are, because we have had cases where patients were ended up on ITU and still their PCR. So no test is 100%. And as I said at the beginning, I always interpret the results in the context of the patient. It can be difficult in a pandemic when people who are doing the tests are not getting the opportunity to get that test interpreted by the doctors. It is done by somebody in a testing center, and the result comes on a text message. And sometimes, yes, it can be difficult to interpret for that particular individual. But on the whole, I think we are doing the best in terms of testing and using a lateral flow test, which I called a point of care test, where appropriate, so that you can try and make the best use of the tests available to make your decisions.
And moving on to the asymptomatic people. So the question on the Facebook was, how do you know you're asymptomatic? Is it via a test? And what do you do? You know, if you are one of the people that can pass it on, how do you break the chain?
So that is where, you know, the difficulty has been in terms of, so yes, as an individual, you can't, unless you had access to, like you've got in your, from your workplace, a lateral flow device. So most healthcare workers, and in some very soon in schools, they'll be asked to do a routine weekly or twice a week lateral flow test, and that's the only way you can pick up on asymptomatic people. And again, you can argue, why should we not have a PCR test? But the idea is, you know, to try and do it in the most cost-effective way, but also in the most time-efficient way as well. Because if you diagnose people late, they've already spread it to so many people, and that's where the role of the lateral flow test comes in. Although it's not a perfect test, but it does help in some ways to pick up early infections in the appropriate setting.
I think, may I add something here? Tests are to confirm the disease, but it should not be taken that you should not wear a mask and you should not practice the isolation or stay at distance away from the other people, because lot of asymptomatic people are in the community. You see, this is the problem which has happened. The countries where they have been very strict about the people avoiding the spread of the disease by adequate restrictions on the disease spread was much slower. So a lot of asymptomatic people are spreading the disease. This is more of a need to take adequate precautions, and you should protect the others. I have every right that I can take the risk for my life, but I shouldn't put somebody else's life at risk.
On the same token, if I think it's a very important subject to stress the importance of continuing to take the precautions. And I will add here a verse of Quran, because we need to refer back to what our Deen tells us in these situations, because many people have some misbeliefs on this. I'll refer to these verse 32 of Surah Al-Ma'idah, the near translation of which is that whosoever killed one person without a valid reason, it would be as if he has killed all mankind. And whosoever saves a life, it is as if he has saved the entire mankind. We're all familiar with this, right? So if we extrapolate that to the current situation, anyone who knowingly does not take the precautions falls into this category of being responsible of causing death, which is unacceptable. So it's obligatory upon us from the fiqh point of view to take full precautions which are in our means to take. And I think that's important to understand for all of us, because we do tend to have this feeling within us that it is just a myth and there is no need, or it's okay when nobody's watching, we can get together. The issue is that now we know with the studying the disease and its spread patterns, that what are the factors which cause it, and clear guidance is available. So this is absolutely obligatory upon all of us to follow the guidance.
Quick fire, does the vaccine have a microchip in it?
Again, over to Dr. Mansoor.
So again, I think I don't know what people would,
They want better phone
I
signal.
don't know what I'm not an IT person, but I don't know what a microchip does actually. But I believe that it's a component in the computers which help you to, drive some processes. Okay, so if you look at that, as I said to you, both the vaccines have got a genetic code which is delivered either through a lipid particle or through the adenovirus, and it instructs the body to produce this protein. And so that is what it is. So maybe the rumor that has gone around that it is a microchip, somebody from an IT world would have used that analogy to try and explain what this vaccine is supposed to do. And
I think there
people
was
have taken it the
when it
other way
came out
around.
when it came out in China, I think there was a rollout of 5G. So there's this correlation that is happening. But that's fine. Just quick fire, yes or no? Does the vaccine contain pig in it? People have just joined. Yes or no?
No, no.
Question from Amir on Facebook. If a person has had the virus, at what point would it be safe for them to take the vaccine, and would it be necessary to make a full recovery before receiving the vaccine?
Dr. Azher,
I think I can answer this. When somebody has an active disease, we ask them to avoid the vaccine. So they shouldn't take it when they have symptoms. But I think after about 6 weeks or so, I think because they get antibodies anyway as they respond to it. So the antibodies last for about 3 months in your body anyway. So they are protected for a reinfection. So there is no hurry to take the vaccine. If they can wait 6 to 8 weeks and then take the vaccine, that is better from that point of view. Scientific point of view, there is no rush to take the vaccine before 3 months or so. Yeah.
So 60 to 90 days.
Yeah.
Yes. There is new data now which has come out again. I think studies on healthcare workers primarily has shown that people who had the infection had protection for up to 5 to 6 months. So there is data, because we didn't have that information before, that if you've had the infection, what is the likelihood of you being protected and for how long. So because we've had only that length of time that we've been able to study this group, we do have now definite evidence that I think the figure is around 83%, if I'm not wrong, but substantial protection from getting, or rather from getting another infection up to 5 to 6 months.
Okay. Another question from Facebook. This is from Zora. I would just like to clarify firstly that this question, we would ask the sister to go to her local GP and healthcare, but in short, it's about if someone has a compromised immune system, what do they do with the vaccine? So this one in particular, it says, I've been on dialysis for 16 years. My immune system recently has taken a crash. I've been very sick, and the doctors have said my immune system is lower than usual. Is it safe for me to take the vaccine, and can my body handle it? So people who have compromised immune systems, what should they do with the vaccine?
So again, so when people have a low immune system, there are two problems. One is if you give them a live vaccine or a live attenuated vaccine, and then they can develop an infection rather than protecting themselves from the disease. But all these three vaccines which are being used in the UK are not live vaccines. The adenovirus itself is it's not able to replicate, so it shouldn't cause any problems even in people with low immune systems. So that's not the issue. The issue with the people with low immune system is whether they will have the same immune response. As I said, the vaccine itself does not have antibodies. The antibodies are produced by the person's own body. And if you have a low immune system, we don't know how much antibody will be produced in those by those people. So the effectiveness of the vaccine in that cohort is to be seen. And again, I know there are groups of clinicians who are actively going to look at. We are recommending that all immunosuppressed or immune compromised people get vaccinated with these vaccines. But there will be groups which will be studied to see how effective the vaccine is going to be in these patients by doing antibody studies or by just looking for clinical indicators for them getting infections going forwards.
Okay, just like to remind the viewers and us as well, we have about 15-20 minutes left, so we'll have to speak to the last one. Dr. Aasem, if you don't mind, could you just very shortly explain in Urdu, please, why the vaccine is not recommended for pregnant women?
जी, ये जैसे हमने पहले बात की, प्रेगनेंसी के दौरान अभी तक इस वैक्सीन के ट्रायल्स कंडक्ट नहीं हुए और ये एक इसके इफ़ेक्ट्स क्योंकि पूरी तरह से डॉक्यूमेंटेड नहीं है, इस वजह से इस वक्त इसको प्रेगनेंसी में रिकमेंड नहीं किया जाता। लेकिन एट द सेम टाइम अगर किसी कोई प्रेग्नेंट लेडी सिग्निफिकेंट रिस्क पे हो ऑफ गेटिंग द वायरस, तो वो अपने डॉक्टर्स के साथ रब्ता करके अंडर स्पेशल सर्कमस्टांसेस इस वैक्सीन को लेने के बारे में सोच सकते हैं। लेकिन इन जनरल इट इज़ नॉट रिकमेंडेड क्योंकि अभी ये इस चीज़ पे रिसर्च नहीं हुई।
Dr. Mansoor, if you could do that in Bangla as well, please, and just repeat the question in Bangla so people understand.
So যে কোয়েশ্চেনটা জিজ্ঞেস করা হয়েছে সেটা হচ্ছে যে যারা গর্ভবতী তাদেরকে ভ্যাকসিন দেওয়া উচিত কিনা। তো আমরা যেটা বলছি এখন যে যারা গর্ভবতী আছেন তাদের ভ্যাকসিন না দেওয়া ভালো, কিন্তু যদি যে মহিলা গর্ভবতী তার অন্য কিছু প্রবলেম আছে, তাদের ইমিউন সিস্টেম লো আছে বা অন্য কোনো কন্ডিশন আছে যার জন্য ওদের বেশি ক্ষতি হবে যদি ওদের কোভিড ইনফেকশন হয়, সেই ক্ষেত্রে ওরা নিজের ডাক্তারের সাথে যে অবস্টেট্রিশিয়ান আছে বা জিপি আছে বা আদার পিপল যাদের কাছে ওরা যাচ্ছে ওদের সাথে জিজ্ঞেস করে ডিসকাশন করে ওরা এই ভ্যাকসিনটা নিতে পারে। কোনো ক্ষতি হবে তার কোনো এভিডেন্স নেই, কিন্তু যেহেতু সেফটির এভিডেন্স নেই সেটার জন্য আমরা এখন রেকমেন্ড করতে পারছি না। থ্যাংক ইউ।
Okay, we'll have to go through these a little bit quicker. There's two questions there which I want to group together because I wanted to ask these personally. Hydrochloroquine and ivermectin have been people have said that it's very, very effective. Why are the medical profession not looking at other forms of ways to treat people with COVID aside from the vaccine route? Is it vaccine or nothing, or is there an issue with having things such as hydrochloroquine or ivermectin?
So do you want me to answer this? I think I'll take this one. Protective effect of hydrochloroquine has not come out significant enough to recommend it for protection. Because it was initially, they thought few people who were taking it, some of them didn't develop the infection. But when they looked at the data overall, it has no protective role. In the treatment trial, it failed to show significant. So I think it had more side effects. It caused more harm to the patients who were given hydrochloroquine rather than any benefit. The second important thing is ivermectin. Ivermectin is used in some of the developing countries. It was used as a drug, but there is no data to support that it actually reduces the severity of infection. So I think the only thing which has been shown to be really beneficial is steroids. So steroids reduce the mortality as well as the severity of infection. Antibiotics we give with it because a lot of people after a virus infection develop a bacterial infection because our own body bacteria can become active. So to take antibiotic with that is helpful. The only things which have been very helpful to give you immune system response to fight the disease or the virus is vitamin D and vitamin C and good, actually good healthy diet. So if you have good healthy diet and take vitamin D and vitamin C, they are shown to protect you against serious infection. The black seeds, I mean, kalwanji, there is no trial on it, although it is mentioned as a medicine which is used for a lot of things, for other diseases like asthma and all these, because there is no controlled trials to establish that benefit. We cannot recommend it. But if somebody is taking it along with other things, there is no harm in taking it because it is a drug which has been used for centuries as a medication for some of the immune system responses. Yeah. So I think that is what I can say, unless somebody else knows more about the this habba soda we are calling it, the black seeds. They are basically onion seeds.
Yeah, actually, you've half answered the next question, which was why are there not more Muslim doctors talking about healthy lifestyles and black seed? In fact, someone else, just to join it with that question, why have the government not put forward more things around eating healthy and those kind of things? We know it's out there, especially with vitamin D, but they've not pushed it forward. People are concerned that it's a vaccine or nothing. If you don't have the vaccine, you're going to die and things like that.
No, I think that is a misnomer. What I am trying to say, there are ways to keep you healthy. Everything which keeps you healthy and immune system good, you will work well. You will be fine. You will have less severe infection. But it doesn't mean that if you can take those things and you don't take the vaccine, you think you will get a good protection. There is no evidence. There is no scientific evidence for it. So it is difficult to.
So can I just add to both the previous questions? So with regards to drugs being used for treatment, I think it's good that the media is keeping off it because again, we don't want to be under public pressure to use drugs where we don't have the evidence. As doctors, we'd like to use or do things where we've got some evidence, and there are loads of trials going on with different drugs. And again, when people do research, we come up with some things, and then maybe the numbers are not good enough, or there are certain confounding factors, and something which looks good may not turn out to be good. And it's best to take a considered view, and then we match trials one versus the other. Some other countries might get some other results, and then we look into it a bit more. So to reassure people, there are lots of work going on in terms of treatment for COVID, and we have come up with certain drugs which work. Certainly in UK, the recovery trial showed about dexamethasone, which has been in the news. People know about it, but there are some other things which are in the pipeline as well to be approved for treatment of COVID patients. Going back to the other question about lifestyle, yes, lifestyle supplements, all those things are always good to do. So there are certain things which I call soft things. So it's always good to have a healthy lifestyle. But as Dr. Azher said, a healthy lifestyle does not mean you are not going to catch COVID, because yes, in spite of the healthy lifestyle, if you do your masking, you do your social distancing religiously, then you might avoid COVID. But just a healthy lifestyle without the mask, without the social distancing, or without the vaccine is not going to help you avoid COVID.
So samosa are okay. That's good. We can carry on there then. There was someone who sent in a link from WebMD. I'll just read what they've written. Kumar says the amount of cytokines he sees being produced by cells in response to SARS-CoV-2 infection is about 50 times higher than he has seen. So I guess you'd have to explain what a cytokine or cytokine is and if this is correct.
So again, that is right, that some of the, the reason we've really struggled so much with treating this viral infection, because most of the time viral infections are something which are self-limiting and we don't need to worry about treating them even. But one of the issues with this virus is not only the virus itself, what it does to the body, but the immune response of the body causes a lot of damage as well. And we do see that with certain other infections where rather than the infection itself, the body's immune response, and this is what happens, the cytokine production, which is alluded to, is what is the body producing in trying to fight the infection. And sometimes an exaggerated immune response can be a problem. And that is why, as I said, there are certain drugs which are looking good in terms of being used for treatment. So first treatment is, again, if you look at the steroid side of things, or the dexamethasone that has been approved for use, and does suppress the immune response. And there is another drug, another category of drugs which is looking promising, is another is also effective on the immune response of the body, because the second phase of the infection or the disease is because of the immune response. These drugs are helping, especially the severe end of the COVID disease process.
Okay, we have about 10 minutes and I think we've got 5 questions. So we'll have to go through these at some speed. They're not vaccine related from what I can see. So just really quickly, why are deaths being recorded up to 28 days after COVID, and does this not mess around with the official figures? The 30-second response, please.
Do you want me to answer this? I think because the disease, any disease which bring a patient to the hospital, we have to monitor what happens to them when they get out of the hospital. So this disease, if it is severe enough, it causes damage to some of your other organs also, not only the lungs. You get damage to your kidney, your heart. Some people have effect on the brain. So the disease process can stop or it can slow down, but we have to monitor every disease death within 30 days. So that is the reason it put the figure of 28 days. But it does not mean that after 28 days, you don't have any risk of developing any complications after that.
All right, okay.
People will still be followed up and monitored by their GPs.
Okay. The other question, which was, why have all other major surgeries stopped? Because people can still die from cancer and things like that. So
yes, I think I'll take that question.
I think Aasem may answer this.
Yes. I think this has been the dilemma, and this certainly is the risk, which I think we were not very well prepared for this, especially during the first peak that we had, and everything was stopped for a good length of time. But this time, the hospitals are better prepared, and any life-threatening disease patients like advanced cancers or where there can be life-threatening complications, those patients are still being dealt with. And there are facilities in most hospitals for doing those cases safely. So that is going on, and I hope that this does continue and the disease does not overwhelm the hospitals completely. But if that happens, then this is a possibility. You can't rule it out. We have seen some patients delayed because of the ongoing crisis, and this is a challenge for NHS.
I think I may add here, because milder diseases, there is delay.
Yes.
Serious illnesses, the patients are still seen. I mean, if somebody has asthma and has a mild attack of asthma, or somebody has a mild pneumonia who could be managed at home with antibiotics, it is much safer for the patient to stay at home and be treated at home, because if he comes to hospital and get a cross infection from COVID or something else, the things could be serious. But if anybody has a serious illness like heart attack or cancer or anything, they are still being admitted and treated.
Although they are counseled for the COVID risk, every patient that comes into the hospital to have a procedure is counseled about the risk of acquiring COVID.
Yeah.
Okay, this is the final question, and we're going to go into wrapping up as a summary. Slightly lengthy, but is the science community unified, or is there a valid difference of opinion? So people are saying that there are other immunologists out there who have said things like masks don't work, this is a bad flu. Some people have mentioned certain doctors, which I might not mention, but for example, they're saying things like in April last year, the government advisor said that masks have a minimum effect. So is there a other side where there are legitimate doctors who are saying that masks don't work, or social distancing is not valid for 2 meters and it should be 4 meters now? Is this a valid opinion, or are doctors generally unified that COVID is very severe and these are the best protocols?
Do you want me to answer this?
Yeah.
Yeah. I think because the commonest way of spread of this disease is through your breath. Because you produce the virus, it comes and settles in the air in the droplets and it spread. So this is a very important thing. To mask actually prevents the spread of the virus going further. If somebody simply is not wearing a mask, you probably spread that disease up to about 4 meters around you. So if you're wearing a mask, you can still spread the virus because obviously you're not stopping breathing. A bit of the air will leak around the mask. That is why you need to keep the social distance also along with the mask. The other important thing is if somebody in front of you is wearing the mask, don't stand behind and very close to the person, because droplets which are produced will go towards the back of the person. So don't stand very close on the back. So distance that is the advantage. So protection is from that. And if somebody is not wearing a mask and cough in front of you, they can spread the virus up to 6 meters. So I think the people don't realize that what is the main reason to take precautions, wear the mask and social distancing. It is very important to follow these instructions.
I just want to squeeze in a quick question just before we summarize. I just remembered. Could you explain why the droplets or the virus can stay on certain surfaces for 10, 12, 15 hours? And should people, for example, who shop in Tesco and Sainsbury's and other supermarkets wipe their items of food when they come back? Should they spray their clothes? Should they be regularly changing it? Because I think a lot of people have become quite paranoid, touching things, constantly using hand gel. What's the best way forward?
I think I'm sure all of us needs to mention that we should take precautions in touching things. I think because the virus does stay on the things which you touch on. If you have a virus on your hand, the problem is how the virus get onto your hands is people sometimes cough and sneeze and they touch their face. So that comes to your hands. And then you touch anything, the virus stays. Virus can stay on different materials for different length of time. So it is important to take precautions. If you take precautions yourself and after touching your face or anything, you immediately use the alcohol and clean it, then your hands, you're protecting the others also. So it's important to clean the trolleys or to clean your hands when you touch the things, when you go out for shopping. And second important thing is that whether you need to wash everything when you come back home, I think the evidence for it is not very strong. If you're doing it, you may be feeling more satisfied, but I think the evidence for it is much less now. But washing your hands regularly, using alcohol in between touching the things, and wearing mask and taking precautions. Yes, your face when you are coming out, people like coming from hospitals, we do like to change the clothes when we come back home, but it's for protection of our own family. I think maybe Mansoor wants to add anything to it. Mansoor?
No, I think, as you said, that if everybody follows the rules, then there is less of a problem. So you mentioned, going to the supermarket and touching things and bringing back things home. So if we are using masks and we are not coughing on things, or but at the same time, if we are gelling our hands when we are going into a supermarket or even into a departmental store, and if we've got clean hands which have been alcohol cleaned, then even if we touch things, we are not putting virus or potential virus on those materials. So if anybody else touches them, they are not going to pick it up, or even if they bring it home, they are not going to bring the virus with it, because the person who's touched it before didn't have the virus because they had cleaned their hands. So I think that is where it's important that everybody works together and not be selfish just about themselves.
Just to add,
Okay.
to clarify,
Yeah.
in terms of getting things home and cleaning them is not recommended at this point in time. There is no evidence that helps.
Yeah.
Somebody wants to do it as an extra precaution, that's his own choice.
Yeah.
But as a matter of scientific advice, this is not recommended.
Okay. We have lots of questions, but we'll have to slow it down there. So what I would like, please, is if each of you could give a minute summary in English and then a minute summary in Urdu, Punjabi, and Bengali, please. That would be appreciated.
Okay, I think I'll go first. We haven't covered many things in Urdu, so I think I'll spend most of the time speaking Urdu. Basically, what we have discussed today are the importance of the preventive measures, and we have tried to discuss the various apprehensions people have, various myths which are circulating around, and we hope that we have achieved that objective to some extent, although the subject is very vast and it's almost impossible to address each and every question in its entirety. The important take-home message from today's discussion remains that we should take all the possible precautions that we can, as best as we can, including getting the vaccine when it is offered. So that is the summary of our today's discussion. In saying that in Urdu, ये सबके लिए बहुत important है, बहुत ज़रूरी है इस बात को समझना कि कोविड एक हकीकत है, ये कोई ख्वाब नहीं है, और इसकी पूरी दुनिया में लाखों की तादाद में मरीज़ जो हैं वो इस दुनिया से जा चुके हैं, और रोज़ाना हज़ारों नए मरीज़ अभी भी इस मरज़ में मुब्तला हो रहे हैं। तो ये एक ऐसी हकीकत है जिसका हमें सामना करना है, ये अल्लाह की तरफ से आजमाइश है, लेकिन इसके साथ साथ हमें अपनी जिम्मेदारी पूरी करनी है एक अच्छे इंसान के तौर पे, एक अच्छे मुसलमान के तौर पे, कि जो एहतियाती तदाबीर बताई जा रही हैं उनके ऊपर अमल पैरा होना है। मुख्तसरन ये कि हाथों को धोना, हाथों को साफ रखना, मास्क का पहनना, जब भी अपने घर से बाहर के माहौल में जाएं किसी भी जगह पे, बेहतर तो ये है कि घर में रहें और घर से बाहर कम से कम निकला जाए, लेकिन जब ज़रूरी तौर पर निकलना हो तो मास्क पहन के निकलें। इसको ऑप्शन नहीं बल्कि ऐन ज़रूरी समझना है अपने लिए, और एक दूसरे से फासला रखें कम से कम 2 मीटर का, और आपस में जो सोशल इंटरेक्शन है उसको हमने अवॉइड करना है। कई दफ़ा किसी की मौत पे या किसी के जनाजे पे अगर या फातिहा के लिए या इन सूरत हाल में अव्वल ये है कि इनको अवॉइड करें, लेकिन अगर किसी मजबूरी के तौर पे किसी ऐसी जगह हम इकट्ठे हैं जहाँ ज़्यादा लोग मौजूद हैं तो आपस में फासला, हाथ मिलाना, इसको हमें प्रैक्टिस नहीं करना, फासला रखना है और एक दूसरे का ख्याल रखना है। इन सारे मामलात में वैक्सीन जो है एक नहायत ही फ़ायदेमंद टूल है, एक ज़रिया है इस मुहलिक बीमारी से अपने आप को बचाने का। तो जब हमारी बारी आए तो हम अपने आप को उसमें रेजिस्ट ना करें बल्कि उसमें अपने आप को पेश करें और लोगों को इनकरेज करें कि हमें लेना चाहिए। हर चीज़ में कुछ फ़ायदा कुछ नुकसान, ये ज़िंदगी का हिस्सा है। अल्लाह पाक हम सब की हिफाजत फरमाए।
So So, Zan, do you want me to say something in Punjabi quickly in a minute or so?
Yeah, if you've got 2 minutes, yeah.
Yeah. अच्छा जी, मैं दसना सिर्फ ये सी कि ये ਜਿਹੜੀ कोरोना ਦੀ ਬਿਮਾਰੀ ਹੈ ਇਹ ਬਹੁਤ ਸੀਰੀਅਸ ਬਿਮਾਰੀ ਹੈ ਇਹ ਬਹੁਤ ਦੁਨੀਆ 'ਚ ਤੇਜ਼ੀ ਨਾਲ ਫੈਲ ਰਹੀ ਹੈ ਤਕਰੀਬਨ ਇਹਦੇ 'ਚ 20 ਲੱਖ ਦੇ ਕਰੀਬ ਬੰਦਾ ਦੁਨੀਆ 'ਚ ਮਰ ਚੁੱਕਿਆ ਸਾਰੇ ਤੇ ਇਹਦੇ ਲਈ ਇhtiyat ਬਹੁਤ ਜ਼ਰੂਰੀ ਹੈ ਕਿਉਂਕਿ ਤੁਸੀਂ ਇhtiyat ਨਾਲ ਹੀ ਇਹਦੇ ਤੋਂ ਬਚ ਸਕਦੇ ਹੋ ਸਭ ਤੋਂ ਜ਼ਰੂਰੀ ਇਹ ਹੈ ਕਿ ਘੱਟ ਤੋਂ ਘੱਟ ਤੁਸੀਂ ਇਕੱਠੇ ਹੋਵੋ ਕਿਤੇ ਜ਼ਿਆਦਾ ਲੋਕ ਜਮ੍ਹਾਂ ਨਾ ਹੋਣ ਇੱਕ ਦੂਸਰੇ ਦੇ ਘਰ ਜਾਣਾ ਆਉਣਾ ਘੱਟ ਤੋਂ ਘੱਟ ਹੋਏ ਸਿਰਫ ਜ਼ਰੂਰਤ ਦੇ ਮੁਤਾਬਕ ਕੀਤਾ ਜਾਏ ਲੇਕਿਨ ਜਦੋਂ ਤੁਸੀਂ ਕਿਸੇ ਨੂੰ ਮਿਲੋ ਹਮੇਸ਼ਾ ਮਾਸਕ ਪਾ ਕੇ ਜਾਓ ਔਰ ਹੱਥ ਨਹੀਂ ਮਿਲਾਉਣਾ ਕਿਸੇ ਦੇ ਨੂੰ ਗਲੇ ਨਹੀਂ ਮਿਲਣਾ ਕਰੀਬ ਨਹੀਂ ਜਾਣਾ ਤੇ ਤੁਸੀਂ ਇਹ ਕਰਨਾ ਕਿ 2 ਮੀਟਰ ਦਾ ਫਾਸਲਾ ਰੱਖਣਾ ਇੱਕ ਦੂਸਰੇ ਤੋਂ ਜਿੱਥੇ ਵੀ ਜਾਣਾ ਬਾਜ਼ਾਰ 'ਚ ਵੀ ਜਾਓ ਤੇ ਚੀਜ਼ਾਂ ਹੱਥ ਅਲਕੋਹਲ ਨਾਲ ਸਾਫ਼ ਕਰਕੇ ਫਿਰ ਕਿਸੇ ਚੀਜ਼ ਨੂੰ ਹੱਥ ਲਗਾਓ ਤਾਂ ਕਿ ਤੁਸੀਂ ਕਿਸੇ ਦੂਸਰੀ ਜਗ੍ਹਾ ਦੇ ਉੱਤੇ ਵਾਇਰਸ ਨਾ ਚਲਾ ਜਾਏ ਸਭ ਤੋਂ ਜ਼ਿਆਦਾ ਇੰਪੋਰਟੈਂਟ ਹੈ ਇਹਦੇ ਲਈ ਪ੍ਰੀਕਾਸ਼ਨਸ ਇਹਦੇ ਲਈ ਇhtiyat ਵਰਤੋ ਤੇ ਵੈਕਸੀਨ ਜਿਹੜੀ ਆ ਉਹਦਾ ਸਭ ਨੂੰ ਫਾਇਦਾ ਹੈ ਕਿਉਂਕਿ ਉਹਦੇ ਤੋਂ ਤੁਸੀਂ ਘੱਟ ਤੋਂ ਘੱਟ ਚਾਂਸ ਹੈ ਤੁਹਾਡੇ ਇਨਫੈਕਸ਼ਨ ਦੇ ਔਰ ਫਿਰ ਵੀ ਵੈਕਸੀਨ ਦੇ ਬਾਅਦ ਵੀ ਆਪਣੀ ਮਾਸਕ ਔਰ ਡਿਸਟੈਂਸ ਨੂੰ ਕਾਇਮ ਰੱਖਣਾ ਹੈ ਔਰ ਫਿਰ ਇਹ ਹੈ ਕਿ ਵੈਕਸੀਨ ਦੇ ਬਾਅਦ ਤੁਸੀਂ ਅਗਰ ਖੁਦਾ ਨਖਾਸਤਾ ਕਿਸੇ ਨੂੰ ਬਿਮਾਰੀ ਹੋ ਵੀ ਗਈ ਤੇ ਉਹ ਬਹੁਤ ਮਾਮੂਲੀ ਹੋਏਗੀ ਇੰਨੀ ਸੀਰੀਅਸ ਨਹੀਂ ਹੋਏਗੀ ਜਿੰਨੀ ਕਿ ਬਗੈਰ ਉਹਦੇ ਤੇ ਬਾਕੀ ਦੂਸਰੇ ਅਗਰ ਘਰ 'ਚ ਕਿਸੇ ਨੂੰ ਇਹ ਮਸਲਾ ਹੋ ਜਾਏ ਤੇ ਸਾਰੇ ਉਹਦੇ ਤੋਂ ਇhtiyat ਕਰੋ ਉਹਦੇ ਤੋਂ ਫਾਸਲਾ ਰੱਖੋ ਉਹ ਵੀ ਮਾਸਕ ਪਹਿਨੇ ਔਰ ਆਪਣੇ ਆਪ ਨੂੰ ਘਰ ਦੇ ਲੋਕਾਂ ਤੋਂ ਅਲੱਗਾ ਰੱਖੇ ਔਰ ਆਪਣੇ ਬਰਤਨ ਔਰ ਚੀਜ਼ਾਂ ਔਰ ਬਾਥਰੂਮ ਜਿੱਥੇ ਉਹ ਇਸਤੇਮਾਲ ਕਰੇ ਉਹਨੂੰ ਤੁਸੀਂ ਬਾਕੀ ਲੋਕ ਅਵੋਇਡ ਕਰਨ ਤੇ ਬਾਕੀ ਲੋਕ ਸਾਰੇ ਅਲਕੋਹਲ ਨਾਲ ਔਰ ਮਾਸਕ ਦੇ ਨਾਲ ਆਪਣੇ ਆਪ ਨੂੰ ਸਾਫ਼ ਸੁਥਰਾ ਰੱਖਣ ਜਾਂ ਸਾਬਣ ਦਾ ਇਸਤੇਮਾਲ ਕਰਨ ਅੱਛੀ ਤਰ੍ਹਾਂ 20 ਸੈਕਿੰਡ ਲਈ ਆਪਣੇ ਹੱਥ ਮੂੰਹ ਧੋ ਲੈਣ थैंक यू अल्लाह ताला हम सबको की हिफाजत रखे सबको इस बीमारी से बचाए
তো আমি সংক্ষিপ্ত কিছু বলতে চাই তো করোনা ভাইরাস যেটা আপনারা জানেন যে সব জায়গায় প্রবলেম করছে অনেক লোক ইনফেক্টেড হচ্ছেন অনেক লোক মারা যাচ্ছেন সবচেয়ে জরুরি যে আমরা যে সময় যে ইনস্ট্রাকশন আমরা পাচ্ছি গভর্নমেন্ট থেকে সেটাকে ফলো করা উচিত ইনক্লুডিং মাস্ক পরা ডিস্টেন্স মেনটেন করা 2 মিটার যেখানে রেস্ট্রিকশন আছে কাজে যাওয়ার বা স্কুলে যাওয়ার সেখানে ওটা পালন করা তার সাথে একটা যা হেলদি লাইফস্টাইল আমরা করতে পারি সেটা করা উচিত কিন্তু তার সাথে যদি আমাদের ভ্যাকসিন অফার করা হচ্ছে তাহলে ওটাও নেওয়া উচিত যেহেতু ওটা দেখা গেছে যে ওটা করোনা ভাইরাস ইনফেকশনকে অনেক ক্ষেত্রে প্রিভেন্ট করছে এছাড়া যদি যাদের ইনফেকশন হয়ে যাচ্ছে তাদের সেলফ আইসোলেট করা উচিত যা তাড়াতাড়ি টেস্টিং করা উচিত যাতে কনফার্ম হয় আর যদি কোনো অ্যাডভান্স সিমটমস হয় শ্বাসকষ্ট হয় তাহলে হাসপাতালে যাওয়া উচিত আমি আশা করছি যে সবাই এইগুলো ফলো করবেন আর যে আমাদের এনএইচএস এর উপর যে প্রেশার পড়ছে যে লোকজন মারা যাচ্ছেন বিকজ অফ এটা স্প্রেড করার জন্য এটা কমবে আর আমরা এই যে অবস্থা আছে তাতে আমরা বেরোবো থ্যাংক ইউ
Okay, so first I'd like to again thank the people who have organised this, Islam Bedford and everyone that was involved, to Dr. Aasem, Dr. Muhammad Azher and Dr. Mansoor Raza for taking time out of their busy schedule and sharing their wealth of knowledge. We hope that through this webinar you now feel more confident, at least in the vaccine. We're not saying from Islam Bedford's point of view that yes, you should take it or no, that you shouldn't take it. It was just purely to dispel the myth around it. So we hope that's taking it through. Please remember always to use alcohol gel in your hand, space, listen to government advice and your local doctors. And from a mental health point of view, not to overburden yourself on listening to the news. If you don't feel that it's aiding you in any way, you don't need to keep checking any of the news, because it can bring a lot of people down. And we know people have gone into depression. Speak to your local GP, to your family and friends if you do feel down about this. And also from our religious perspective of being Muslims, we need to remember that Allah does not burden their soul beyond what it can cope. So please remember that. And also, just on the last point, Ibn Taymiyyah rahmatullah alayhi says that Allah has with him high stations in the house of his generosity, and no one reaches them except the people who go through trials and tribulations. So this is a trial and tribulation, and that which Allah has legislated upon the believers when they are afflicted by calamities, that they say, indeed we belong to Allah and to Him we shall return. So inna lillahi wa inna ilayhi raji'un. So we need to remember this, that our faith will take us through and everything is written as it will be. Again, final disclaimer, this is purely for informational purposes for everybody. We hope that you have benefited from this. If you have any more questions, if you send them over, possibly we can do something similar again in the summer, maybe when there's more data coming out and more questions with any other vaccines that pop out. Dr. Aasem, Dr. Azher and Dr. Mansoor Raza, Jazakallah khair for taking part, and stay safe. Assalamu alaikum.
We want to thank the organizers. I think it is a very good thing to do and to support the community as well as to help to answer the questions. So in case people have any more questions, I'm quite happy to, if you want to forward them to me and we can reply to them. If anybody can benefit from this discussion, I think we feel that we would have done something good for the good purpose of the community in Bedford. Yeah. Thank you.
Yeah, so if anyone wants to send in more questions, you can send it to the Islam Bedford page or to myself, Abdul Kahar, or other people that live in Bedford. If you get in touch with us, we can collate questions and send them over in one go, and we can share the responses on our Facebook. Please also keep an eye out on the video when it's released to share with your family and friends. And also there will be another poll on the Instagram and other social media to see how you've all possibly change your minds or not change your minds with the information given today. Again, thank you for watching, and Assalamu alaikum.